Hi everyone, my name is Naseer Ali. I'm a consultant ophthalmologist from St. John Eye Hospital in Johannesburg, South Africa. A big thank you to the OSN Young Ophthalmology Forum for inviting me to speak today. I'm going to be sharing with you some tips and experience regarding literature reviews. So let's begin. I have no financial interest to declare pertaining to this topic. Any software featured I have no proprietary interest in that. So the overview of my talk will begin with the definition of what is a literature review when it's needed, go to the aims of a literature review and how to conduct one, research strategies, how to synthesize the evidence, and then we will conclude. So when we ask what is a literature review, there are two interesting definitions that I've come across. The first is a systematic method for identifying, evaluating, and interpreting work produced by researchers, scholars, and practitioners. The first definition is fine if you are just looking to answer a clinical question or if you are looking just to review the available literature on a body of knowledge. However, if you are conducting research or writing up a protocol, I think the second definition is more important. It is a synthetic review and summary of what is known and unknown regarding the topic of a scholarly body of work, including the current work's place within the existing knowledge. The latter part of that definition is very important because whenever you are doing a protocol or writing up your publication, it's very important to place where your study is, where it fits in, or what question it's trying to answer within the body of knowledge. So a basic question of when is a literature review needed? Like I said previously, during protocol development, I'm sure in Nigeria, a master's during your ophthalmology residency is compulsory, just as it is in South Africa. And so all of our residents are required to do a protocol for an MMed. And so it's important when you are doing this that you do a thorough and well-designed literature review. If you are in the clinic and you come across a patient that you need to make a management decision on, so you need to answer a clinical question, you then may decide to do a literature review as well to get your answer. When you have then collected data on a study that you are doing, you need to write up the article for publication. And so you would need to redo the literature review from your protocol stage to see if there has been any advancement, etc. Also, you'd like to compare your findings with the findings of the available literature, both the literature that your study agrees with and the literature that your study does not agree with. If you are doing a review article on a specific subject, for example, diabetic macular edema, you would then want to review all of the available literature. If you are doing a systematic review or meta-analysis, so this represents the pinnacle of literature review in that it is a rigorous standardized method in which you try and look at the entire body of published work on multiple platforms or databases to answer a pertinent clinical question. And lastly, if you are doing a scientific lecture, such as what I'm doing now, you would also need to consult the body of knowledge and literature. So if we look at the social construct of a conversation, it makes it easier to understand why we need to do a literature review. So most of us think that journals exist just to publish research. And that's true, but they exist for a higher purpose. And if you think of research as a scientific conversation, in which different parties are putting forward their hypotheses and their arguments. So for example, if you were at a function or at an occasion and you happened upon a group of people who were having a conversation, the first thing that you would do when you entered that gathering was to listen to what was being said. Then you process what they are saying, and after that, you then make your contribution. So the process of listening and understanding and digesting what's being said is the process of literature review, or is analogous to that process. And when you are putting your thoughts, etc., forward, that is then how you frame your study and you answer your question when you've got your results from your research. So then we look at the aims of the literature review. So if we think of a hypothetical study, for example, of convacept versus bevacizumab in the treatment of diabetic macular edema, your literature review provides the context of your study, including your research question. So in this case, you may have looked at other studies testing anti-VEGF efficacy, and you may decide that that's a good idea. However, no study has looked at convacept versus bevacizumab in a head-to-head comparison. They may have done so with ranibizumab, aflibercept, etc. And so you may decide that this is a vital question that you would like to answer. And so a literature review informs that. It also tells you what methodology to use in your study. So for example, in this hypothetical study of convacept versus bevacizumab, we may see from the literature that a randomized clinical trial is the standard that we should be using. And a retrospective cohort study, for example, is fraught with weaknesses and may not necessarily give you a good direct comparison. It also avoids duplication. So if you do your literature search and you see that convacept and bevacizumab have been compared directly in an RCT, this may not be a good study for you to pursue for various reasons. It also identifies novelty. So if you've seen that the study has been done before and you want to be at the cutting edge of research publication, you may decide that I don't want to pursue this further. It also ensures that research standards are met. So what this means is, for example, in previous randomized clinical trials, they may have had specific visual acuity cutoffs or specific central foveal thicknesses that they used before enrolling patients. And you may want to be in line with this so that your results are more generalizable to the body of research that is out there. So now that we know what we're aiming to do with a literature review, we then need to look at how to conduct one. And your major source, especially in the modern world of conducting a literature review, is to consult various databases. The list pictured here is not exhaustive. However, they are the most commonly used databases that are available. These include PubMed, Scopus, Embase, and Web of Science. Cochrane only does reviews and systematic reviews and meta-analyses. So if you're looking for that, Cochrane is a good place to look as well. It does, however, help to consult colleagues or when you go to conferences to keep an eye open, as it may be worth it that you would pick up citations or articles that you may not pick up generally when you go through databases on your own. A librarian can also be of invaluable assistance when trying to help you with your search strategies in databases, etc. So we're going to go through some search techniques in some of the databases. We're going to use PubMed. It's the one I use most often, so I'm most familiar with it. The other databases work on a similar basis with some slight nuances. So if you, for example, wanted to do a literature search on pseudotumor cerebri, and you put that in, so when you log into PubMed, you'll get you'll land on the landing page. You put in your search term and you hit search, you can see that you get 4,630 results. If you then put your term only in inverted commas, it restricts your search only to that term. It will not look at other terms. The former does look at other terms, and when we see what terms it looks at in the next slide, you'll understand what I mean. So here we're only getting 4,585 results. So if you're looking for something very specific, you can use quotation marks, and it will restrict your search only to that specific term. If we use the related term, such as idiopathic intracranial hypertension, you can see that we actually get more results. So we get 5,709 results. So you may be wondering, why is there a difference? And the difference is in terms of how PubMed uses those terms to search for articles. So how did this happen? So when we searched for pseudotumor cerebri, we got 4,630 results. And the reason for that was PubMed searched for pseudotumor cerebri as a mesh term, and pseudotumor and cerebri separately as well, if they occurred together within an article, so not necessarily next to each other. If we just used pseudotumor cerebri in inverted commas or in quotation marks, it only searches for that term. So you can see that's why we yielded less articles, because there's less terms that are used when doing the search, and this is by the PubMed algorithm itself. In idiopathic intracranial hypertension actually includes the pseudotumor cerebri term. So when you enter this term, PubMed then includes terms for pseudotumor cerebri as well as the terms for idiopathic intracranial hypertension. So this is quite helpful because now you are casting your net slightly wider. Remember, these were all with the basic search function. We're now going to go into the advanced search function in how to get more articles by building a search strategy. So like I said previously, when you log into PubMed, you will get onto the landing page, and this is the PubMed landing page. There's an advanced tab over there, which helps you with advanced search. So if you click on it, you then come to this page. And this page is the advanced search builder. So you can see it has a number of boxes. The first one is the all fields box. This includes mesh terms, articles that are indexed in Medline, etc. Your search term is the one that you will use most of the time. And your query box then builds your search strategy. So we'll do one for pseudotumor cerebri, and we'll see what results we can get. Okay, so the first thing we do is we type in pseudotumor cerebri into the search box over here, and then we add. Now, it can add with various Boolean words, such as and, or not. We would like to use or for this because we're going to use the term pseudotumor cerebri as well as idiopathic intracranial hypertension, and those words mean exactly what they say. So when we say pseudotumor cerebri or idiopathic intracranial hypertension, what we mean is if either of the terms are used, we want to see literature on that. So we've done that. We've added pseudotumor cerebri or idiopathic intracranial hypertension. We then hit search. As you can see, those words have been used for our search, and we yield 5,736 results. So we're now getting more results than both terms if they were used in isolation. And that's important. So whenever you are doing a literature review, try and use the advanced search builder as much as possible, especially if you're trying to get all of the literature on the topic. Because by using the advanced search builder, you cast your net wider, and you therefore get more publications for you to go through. So just to show you what PubMed did, we got 5,736 publications, as said before, but it's now combined all of the terms. So pseudotumor and cerebri, if they occur separately, as well as all of your idiopathic intracranial hypertension terms as well. And that's why we are getting more results. So you may think 5,000 results are just way too much. I really don't want that many. And I'd like to see, for example, what the latest research is. So the research in the last 10 years. So what you can then do is use the filters on the left side of the search results page. And it's got various filters that you can then use to filter your results so that you only see results that are appropriate and applicable to you. So I did that with pseudotumor cerebri and IIH. I only wanted to see articles in the last 10 years, and you can see my results then dropped to 1,438, which is much less than we had before. And if you just want to review the current literature, then you can do that, and that will assist you in automatically weeding out any results that you don't want to have. Okay, so you may think, now I've got all of these articles, etc. How do I then begin putting together what I would like to write up, either for my protocol or for my article for publication? So if we consider our hypothetical study again of convacept versus bevacizumab in the treatment of diabetic macular edema, the first thing I'd like to say is be organized. You need to know what you are doing in terms of what question you are looking to answer and how you are going to approach that question. So you would need to mark off all of the pertinent articles, and then you would also have to look at what aspect you are specifically looking for. So for example, it would be important to include all of the studies that were randomized clinical trials using anti-VEGFs. The participants, obviously you're only looking at participants with diabetic macular edema. So any studies using anti-VEGF for other causes, you would then exclude. The setting may be important. Maybe you are looking at a study in a real world setting versus a study in a hospital or clinical trial setting, and that may determine how you include or exclude literature based on what you want to include in your write-up. The methodology, like I mentioned previously, you would be wanting to include clinical trial studies, mainly if you are specifically looking at clinical trials. However, if you are looking at real-world data, you may then expand your search to include cohort studies or case series, etc. Citation managers can also be helpful, and we'll speak a little bit about them in one of the upcoming slides. This helps you to organize your citations. So any studies that you would like to include, it imports the study. Sometimes it can even import the full text for you, and it helps you during your write-up to arrange it specific styles that the journals are looking for, etc. Regarding how many citations you should include, so there's no magic number. Protocols generally require less citations than full publications. However, it's quite helpful to look at what your the peer research is doing, so research on the same topic. Your supervisor may help you with your protocol, etc., and tell you at our university 20 to 30 citations is fine. And that may vary across different institutions. If you are looking to write up a publication, the journal usually has a specific guideline for authors, and that will generally give you an idea of how many citations you should include. If the journal does not do this, you may look at articles that they have published recently to get an idea as well. But unfortunately, there is no magic number. Like I said, various citation managers can help you. Zotero, EndNote, RefWorks, Mendeley, Papers. Some are free and open access, others you have to pay for. It generally depends on what your university or your supervisor uses, and you usually just fall in with that. Okay, so in terms of your write-up, we're going to use our hypothetical study again. So you need to decide what you want your readers to know. So, for example, you would like them to know a little bit of the history of anti-VEGF agents, what studies were done before, and how your study fits in with that. You would also like to define the problem. So in a study of diabetic macular edema, before you get into the treatment of diabetic macular edema, you would want to first give the prevalence of diabetes mellitus worldwide. Then, for example, if you are focusing in on Nigeria, from a global level, you would then go to an African scale, then maybe a West African scale, and then locally looking at Nigerian data on the prevalence of diabetes, then diabetic retinopathy, and then diabetic macular edema. So what happens is you start from quite a broad definition of the problem, and you focus into the exact setting and treatments that you are going to use in your study. When I say broad to narrow, it doesn't mean you have to write pages and pages on when you're quite broad and general. You would, a line or two may be significant just to frame the problem on a global level, then on an African level, etc. So this is what I've mentioned already. And then once you've defined the problem on diabetic macular edema, you then may want to define the treatment options. Depending on the word count and the journal that you're submitting to, you may want to say that laser was the gold standard before and it's been superseded by anti-VEGF agents, or you may decide to leave that out and say anti-VEGF is currently the standard of care and that's what we use. And then you always want to identify a gap in the literature in terms of direct comparison. So in this case, for example, if Convacept has never been tested against bevacizumab, which is your standard of treatment, in a direct comparison randomized clinical trial, you may want to highlight this fact and say that our study intends to compare these two, either in a superiority or non-inferiority outcome basis. Just a word on plagiarism before we continue. So plagiarism can be defined of taking work, whether it be words, images, or ideas. So that's lifting it directly from others without proper reference. Notice in this slide, as well as previous slides, I've used quotation marks. And this is because these need to be used when it's taken directly out. If you are referencing someone else's work in your own words, you may then leave out quotation marks. It's regarded as a serious misconduct. If journals pick up on it, they will conduct an investigation and they will redact your article and may attempt to take disciplinary action against you as well. This should be avoided at all costs. Not only is it not fair to the researchers whom you are plagiarizing, but it's also not fair to yourself. And the reason for that is you want to put what your novel research is out into the world, and plagiarizing just detracts from that. Okay, so then I'd like to focus on other common pitfalls to avoid, such as only looking at old publications. And the problem with this is it may not take the most recent evidence into account. So for example, in our diabetic macular edema study, if we were mainly citing research that looked at grid laser for diabetic macular edema, we'd miss out on a large proportion and by far the majority of the research that focuses on anti-VEGF. So what you could do if you would like to cite some older publications would be to cite only landmark studies. So for example, the ETDRS study that focused on diabetic macular edema. Doing this also propagates outdated results. So your reader may then get an incorrect view that grid laser is the treatment of choice because it was discussed at length in the study, and anti-VEGF was given a footnote status, basically. So what you should do to mitigate this is to then state the age and the reason for citing. You may state that the ETDRS study was a landmark study and it showed these results, and that's why we basically cited it. If you include too few or too many studies, this can also cause problems. Too few studies may give an inadequate context or treatment option. So coming back to our example, if you spoke mainly about laser, it doesn't tell your reader why you're wanting to compare two anti-VEGF agents, and this can cause problems. If you do too many studies, so you quote 40 studies looking at laser treatment, for example, and another 40 looking at anti-VEGF, your reader may become confused. So you need to decide what message you want to convey to your reader, and you select your references accordingly. Any outlier studies or studies that have conflicting results, if you only focus on outlier studies that may show either miraculous results or results that are not necessarily showing any efficacy, your literature review then becomes biased. So whenever you find studies that have conflicting results, cite both and try and understand why they had different outcomes and try and provide reasons for that. Studies sometimes at odds with your findings, you may tend to shy away from those, but that's not a good idea because it then gives extreme bias. So you would be pushing one line of argument that may not necessarily be true for all patients. What you would need to do is to identify why those studies differed. Maybe there was a difference in design methodology. Maybe they used slightly different outcomes, or how they measured their outcomes was different. So you should identify these differences and rather discuss it, as opposed to just leaving those studies out completely. Also, avoid oversighting your own work. It's good to to cite any work that was done by you or your research group in the past, but don't oversight it for any flimsy reason or try to fit it into any study that you're doing, because it gives a false impression of the impact of your work. Because one of the metrics by which the impact of research is measured by is the number of citations. Don't also make your literature review too long. Like I said previously, with too many studies included, it can cause a lot of confusion as to what is the gold standard of treatment now, etc. So only include relevant studies, and your journal guidelines will help you quite a bit with this. Also, have a structure to your literature review, and it must be organized. Otherwise, points that you make may be overlooked. So, for example, if you started discussing anti-VEGF first and then put the burden of diabetes and then put laser was shown to be efficacious in stabilizing vision, your reader can get confused and may not come with a good understanding of the magnitude of the problem and what the current gold standard of treatment is. So in conclusion, you need to be organized. You need to decide exactly how you are going to collect the articles, which articles you are going to include, and how you are going to do the write-up. Also decide what aspect you would like to discuss. So for example, you may discuss the clinical trials under one section and the anti-VEGF agents themselves in another section, and each section would have different citations to support your discussion. Stick to the main points of each article. So every single point of all the articles don't need to be discussed. That will make your literature review too long. Avoid the common pitfalls that we've discussed previously. And lastly, practice, practice, practice. What we mean by this is to have a theoretical discussion about literature reviews is one thing, but the only way you become better at it is by doing more literature reviews, by writing more publications, by reading more articles. So the more that you actually do it, the better you get. It's like with cataract surgery. You can watch all of the videos or all of the lectures that you would like, but you learn so much more by actually doing it. So I would encourage you to do this. These are my references, and thank you for your time.